Hello, good evening, guys. Welcome back to our channel, Medical Guruji. I hope you all are doing great at your place. So, today I'm going to start my lecture, and that is vital signs. As you all know, vital signs play a crucial role in the life of a patient because, as per the vital, our doctor is assessing them. So, total we have five vital signs, and the fifth vital signs we called it as a pain. Okay, so let's start. The very first is the body temperature, that is the normal body temperature, 36.1 degrees Celsius to 37.2 degrees Celsius. And if we convert it into the Fahrenheit, then it is 97 degree Fahrenheit to 99 degree Fahrenheit. Then we have a various way to measure the temperature of the body, that is axillary, then we have oral, then we have rectal, then we have tympanic. The axillary, the most commonly we are using, but it is less accurate. Okay, so and if you are using the tympanic one, then we should check for any redness, any discharge, any swelling. If it is there, we should not use the tympanic one. Okay, after temperature, I will discuss about the heart rate, that is a pulse. We call it as a pulse, that is 60 to 100 beat per minute. And we have 10 number of the pulse. The very first is temporal pulse, then we have carotid pulse. During CPR, you saw this one we are using mostly. Okay, during cardiac massage also we are using the carotid pulse. Then we have apical pulse. If you anyone get admit in the hospital, our doctor is checking the apical pulse. Okay, then we have radial one, the thumb side we have the radial pulse. Okay, like this we are checking, and from the small finger there is a ulnar pulse. From there we are checking the ulnar one. Okay, then we have the brachial one. At the brachial side we have a brachial pulse. Then we have the femoral pulse at the femoral side. Then behind the knee we have a popliteal one, then dorsalis pardis and posterior tibia. These all are the pulses we can check, right? Then with the age, our heart rate slows down. Like in geriatric patient, means the age above 65, or we can say the old age, they have a less heart rate as comparison to the younger one. And there are multiple factors that also affect our heart rate. Like if you are doing exercise, then we have a increased heart rate, and if we are in any stress, then our heart rate get increases automatically, because the emotions stimulate the sympathetic nervous system and it increases the heart rate of the patient. Okay, then if our blood pressure is low and circulatory volume is low, then it also increases the heart rate. And if we are having a temperature, then also our heart rate get increase. Okay, then in case of hemorrhage also heart rate get increases. Then after that, respiratory rate, the normal respiratory rate is 12 to 20 breath per minute, and it is the exchange of gases between the atmosphere and the blood, and the blood and the cells. Okay, and there are the many factors that are affecting the heart rate as well as the respiration. And if in our body carbon dioxide level is high and oxygen level is low, then it increases our heart rate, respiratory rate. Okay, then if we have a head injury and intracranial pressure get increases, it affect the respiratory center of the brain, and it's slow down the respiration. Okay, and we are counting the respiration for 15 seconds, and then we are multiplying it by 4. If we are counting it for 30 seconds, then we can multiply it by 2. Okay, but for the ill patient we should not count it for 30 and 15 seconds. We should count it as for full 1 minute. Okay, after that, blood pressure, and the normal blood pressure is 120 by 80 mm of Hg, and it is the force on the wall of the artery and exerted by the blood from the heart. Okay, and when our heart get contracted and there is a force, of the blood, and we call it is a systolic one, that the peak pressure, that is the systolic blood pressure. Okay, and simultaneously that time our ventricle are relaxing, and the remaining blood in the artery that exert a force, that it is a diastolic blood pressure. And the difference between the diastolic and the systolic blood pressure we call it is a pulse pressure. Okay, after that we have the pain, then we have the acute and the chronic. Acute, that pain is for the short period, or we can say for 1 or 2 days, it is called that as acute pain. Then we have a chronic one, that is for longer, year, months. Then we have a number of scales we are using to assess the pain, like Wong Baker face pain rating scale. then we have a numeric 1, then we have flag and flag. This is the end. Like, share and subscribe, and whatever I'm giving you the information, this is all on the true scenarios, whatever I learned from my organization. I hope you like this one, and I will try to give you more informative materials. If you face any issue, if you if you don't like anything about my lecture, you can tell honestly in the comment. Okay, I will respect that. Thank you so much. Have a nice day.